Tonight at 6, trials for a second coronavirus vaccine bring yet more hopes of a way out of this pandemic. Britain buys up 5 million doses. This one, also from America, has proved almost 95% effective in trials. The boss of the company, Moderna, is delighted.
I broke into an ear-to-ear grin when I heard the numbers. It really exceeded our best hopes, and it is an incredibly exciting moment for us.
It's brilliant news, absolutely brilliant. It's the second penalty now. That's also gone into the back of the net, so we're starting to feel in a better position.
It comes just a week after Pfizer released similar results for their jab, also tonight.
It doesn't matter that I'm fit as a butcher's dog, feel great, so many people do.
But the Prime Minister is still forced to self-isolate, along with 6 Tory MPs and 2 political aides after a breakfast meeting last week at Downing Street. Testing pilot schemes mean relatives should be able to visit loved ones in care homes by Christmas, says the government. And the British diplomat who jumped into a river in China to save a drowning student.
And coming up on BBC News, a superhero has swept in to buy Wrexham Football Club. Fans celebrate as film star Ryan Reynolds announces he's purchased the National League side.
Good evening and welcome to the BBC News at 6. There's more good news in the search for a COVID vaccine. Another one has emerged which appears to be even more effective than the first one, following clinical trials on 30,000 people in the United States. The American firm behind it, Moderna, says it is almost 95% effective. It has been tested on a wide range of people, including the over 65s, people with underlying medical conditions, and those from different ethnic backgrounds. And crucially, it can be stored at normal refrigerated temperatures, making it much easier to distribute. Tonight, the government said it had secured 5 million doses of the vaccine. It's one of around 50 vaccines now being tested on people in clinical trials worldwide, and its success, along with Pfizer's announced last week, raises hopes that others could also be effective. Our medical editor Fergus Walsh reports.
Another dose of hope and further evidence that vaccines will provide a way out of this pandemic.
Thank you.
Stunning early results from this trial from US firm Moderna have eclipsed the strong ones just a week ago from Pfizer-BioNTech.
I broke into an ear-to-ear grin when I heard the numbers. It really exceeded our best hopes. And it is an incredibly exciting moment for us as a company and as a world as we start to develop tools to fight the virus.
30,000 volunteers in the US took part in the trials. Half had 2 doses of the vaccine a month apart, the rest dummy injections. Early analysis shows there were 90 COVID cases in those given the dummy treatment and only 5 in the vaccinated group. Moderna says this shows the vaccine is over 94% effective at preventing COVID. What's more, there were 11 cases of severe disease, but none among those who got the vaccine.
I'd like to update you on the latest coronavirus data.
The government urged people to follow the COVID rules because even an effective vaccine won't change the way we live for months. But optimism is growing. Are you a bit more confident today, even more confident than a week ago, that COVID vaccines will work?
It's brilliant news, absolutely brilliant. It's the second penalty now. That's also gone into the back of the net, so we're starting to feel in a better position.
Moderna, like Pfizer, have used a completely new method for creating vaccines which doesn't need the virus itself. It uses the genes for the coronavirus spike protein. This synthetic code, known as RNA, is created in the laboratory and forms the vaccine. This teaches the body to recognise and build an immune response to coronavirus. Before we can all throw away our face masks and ditch social distancing, we're going to need to protect the world from COVID. That will require billions of doses of coronavirus vaccine, and it's why clinical trials must continue. like this one, which began today in Southampton and other sites across the UK. The jab from the Belgian firm Janssen is one of 6 COVID vaccines pre-ordered by the government.
Over time, we will learn which of those works better in different ages and different people with different conditions, and also how to use the vaccines in combinations to give people the best and longest lasting immunity.
Caution is needed. We still need full safety and effectiveness data for the Moderna and Pfizer jabs. But there's a real sense now that some of the most vulnerable to COVID could be immunised before Christmas.
And Fergus is here. More good news, another reason to smile. How optimistic should we be?
Well, Sophie, I was happy last week. I'm even happier now. And it shows that last week's positive results were not simply a flash in the pan. Now, we've got to be cautious. We've got to keep our feet on the ground. But it's looking good. And now, if we get positive results from the Oxford AstraZeneca vaccine, where we've ordered 100 million doses, we'd be in a really good place, because we've only got enough doses of the Moderna jab, and they won't come till late spring, for 2.5 million people. So we can't expect vaccines to change the way we live this winter, and we need to know whether any of these jabs actually prevent transmission as well as stopping people getting ill. But it's about the best news we could hope for, given the devastation to lives and livelihoods from this pandemic.
Indeed. Fergus, thank you. The Health Secretary, Matt Hancock, says care homes should finally be able to allow family visits in time for Christmas. A trial involving coronavirus testing has begun across 20 care homes in Hampshire, Devon and Cornwall. It follows weeks of campaigning by relatives who say residents are deteriorating without family contact. Our social affairs correspondent Alison Holt reports.
This was mid-March before lockdown, the last time 67-year-old Bob Such and his wife Chris were able to hug. He has Alzheimer's and had just moved into a care home.
See you so much. Oh. Yeah.
Since then, most of their contact's been like this, deeply distressing for them both. The testing pilot offers hope for the future, but it still feels a long way off.
It's been absolutely cruel to see him scratching at the window, him calling, come in, come in. He doesn't understand. He's in the latter stages of dementia, and his well-being and quality of life have been severely impacted, as has mine.
Their son's a doctor working on a busy hospital COVID ward. He deals with the risks each day and says it should be possible for families to have closer contact in care homes.
It's a catastrophe for everyone in a similar scenario, including me, because we don't get this time back. You know, my father and lots of other people will deteriorate during this period, and we appreciate the difficulties everybody's facing. It's not easy for us all to manage, but it must be managed, and we must find solutions.
Testing is seen as the key to safe visits. Here I was tested at a home by care staff who had a machine to provide a quick result. The pilot scheme will use slightly different tests, but will allow regular checks for named relatives or friends. It's promised this will then roll out nationally.
Our goal is to ensure that we have the testing available in every care home by Christmas, to make sure that people can then take a test and therefore see their loved ones safely.
To comply with CQC regulations in order.
But with the number of coronavirus cases rising in hospitals, some care homes like this one in Scarborough are also being asked to take COVID-positive patients. They've had to pass high infection control checks.
We have a COVID-positive isolated floor, dedicated staff, dedicated facilities, so they don't come into contact with anyone else. But as I say, these people have to be looked after somewhere, and if we don't look after them, they have to go miles away from where they perhaps live for their recuperation.
It underlines the complications of the situation, balancing the many pressures with the needs of residents and families. Alison Holt, BBC News.
The NHS will be opening a network of 40 long COVID clinics across England, which will be in place by the end of the month. Matt Hancock, the Health Secretary, said that many thousands of people were affected by long COVID, characterised by long-term symptoms of fatigue, muscle pain and breathlessness, including among the fit and the young. Coronavirus infections in Hull have risen at an astonishing and terrifying rate, according to the leader of the City Council. Stephen Brady has written to the Prime Minister asking for more government support and says Hull has been forgotten despite having one of the highest infection rates in the country. Our correspondent Vicky Johnson is in Hull for us now. How bad is it?
Well, over the past week or so, Hull has either been at the top or very close to the top of the coronavirus infection rates. And then this obviously means that there's been an increase in the number of patients being admitted to hospitals. On Friday, our cameras went into the Hull Royal Infirmary and there were about 150 patients. Today, it's close to 190. Many of them are needing intensive care. Hospitals are saying they can cope for now. But today, the leader of Hull City Council, Stephen Brady, has written to Boris Johnson asking him to intervene urgently. He says the city is now at a critical point. He wants a certain flexibility in able to close schools if necessary. We've spoken to the schools minister, Nick Gibb, and he says this absolutely won't happen. But Stephen Brady wants urgent help, and he says he wants the same sort of help that's been on offer to other cities like Liverpool in the past.
Vicky Johnson, thank you. Meanwhile, government plans for mass testing to try to reopen large parts of the economy have been criticised. Scientists today warned it's likely to be ineffective and expensive, and they say the programme should be paused and the test and trace system should be improved instead. Our health correspondent Sophie Hutchinson is here, and this is Operation Moonshot that the scientists are talking about.
Yes, absolutely. The tests that are used in Operation Moonshot are these rapid turnaround tests that in fact Hull is requesting more of. But they came under some considerable fire today from scientists who were attending a briefing, scientists in biostatistics, population and public health. They raised concerns that these tests may only be 50% accurate, and they are concerned that that might give people a false sense of safety if they wanted to visit somebody who was vulnerable, people who might have a negative test. The rapid tests, as I say, are part of the Moonshot programme, and the idea behind that is mass population testing to try and free up people so that they can go about their business as normal if they get a negative test. But the scientists today heavily criticised the Moonshot scheme, saying it hadn't been assessed by the UK's National Screening Committee, and they warned that it was unethical and should be paused. The government has defended the scheme.
Sophie, thank you. Meanwhile, the World Health Organization today said it was extremely concerned by the spread of COVID across Europe. Belgium, France, the Czech Republic and Italy, the first country in Europe to report high case numbers of the virus, have all been particularly hard hit. Across the continent, people are living with restrictions as governments attempt to bring new case numbers down from second wave peaks. A big surge in cases means hospitals in parts of Italy are already near breaking point. In Naples, medics were seen delivering oxygen tanks to desperate patients waiting in their cars, but there's still no new national lockdown. France, by contrast, has been in lockdown since October the 30th with no end in sight. After a big spike in daily infections, cases and deaths are falling again. Catholic worshippers protested yesterday as discontent over the restrictions grows. Germany still has one of the lowest death rates in Europe. A partial lockdown means new infections are no longer surging. Restrictions are now expected to continue into December, with Christmas markets cancelled. And Sweden is bringing in tighter restrictions for the first time. They've had no lockdowns and up to 300 people could gather, but a surge in new cases means that's been cut to just 8. Here, the Prime Minister, 6 Conservative MPs and 2 political aides have all been told to self-isolate after a breakfast meeting in Downing Street last Thursday. One of the MPs tested positive for coronavirus after the 35-minute gathering in a stateroom. Downing Street insisted that social distancing rules were observed. Here's our political editor, Laura Kunsberg.
Well, Sophie, in the last few days, what's been going on in Downing Street has been a bit like a B-movie version of the political drama House of Cards. So it's not surprising that Boris Johnson wanted to get back on the front foot to show that things had calmed down, to show that things were actually getting back on an even keel. But instead, once again, he's been caught up in the coronavirus pandemic himself, reduced to sending selfie videos stuck in the Downing Street flat. Now, our report tonight contains some flashing images, sometimes truth is stranger than fiction. The moment you might dread from your phone or inbox. A message from the coronavirus trackers to stay at home and stay away. The Prime Minister stuck in number 10 too.
They pinged me and I've got to self-isolate because somebody I was in contact with a few days ago has developed COVID. It doesn't matter that I'm fit as a butcher's dog, feel great. So many people do in my circumstances. And actually it doesn't matter that I've had the disease and I'm bursting with antibodies. We've got to interrupt the spread of the disease.
On Thursday, Boris Johnson met with half a dozen MPs, at least meant to be keeping their distance. But on Saturday, Lee Anderson from Ashfield tested positive. The 5 others who were there are all self-isolating now too. Meetings are allowed in person for work. But even in Downing Street, strict rules are meant to be followed to make sure it's safe. But now the Prime Minister's holed up between his desk and the Downing Street flat. Not because he has the disease, but because he spent some time in close quarters to one who has. But after days of dizzying allegations about what's been going on in government, this was meant to be a moment for ministers to get back on track.
Government, like all other businesses and organisations over the past few months, has been learning to do things differently. We're doing a lot of meetings online. The Prime Minister's already, this morning, you've seen a video that he's put out. We're getting on with delivering people's priorities. This has been
like cracking on with rolling out a vaccine, which Labour wants, and sticking to the rules.
This is frustrating for the Prime Minister, I understand that. It's important that he self-isolates. It's important for all of us to say that we've got to comply with the advice and the guidance.
Rules may have never bothered some in government that much. Burning Downing Street feuds flamed into public in the last few days. Dominic Cummings, who couldn't ever resist playing the pantomime villain, walking off into the dark. A lot of metaphorical blood has been spilt on Downing Street's posh carpets of late. So the Prime Minister wanted to use this week to clean up, with announcements on the environment, meetings with MPs, no small matter of Brexit talks that go on too. But an email from the tracers has seen him locked indoors. Perhaps it's coronavirus that's still in charge. Governments can plan for resets, relaunches, restarts, but no minister can plan for real life. Laura Kunzberg, BBC News, Westminster.
The time is just after 6:15. Our top story this evening. Highly successful trials on a second coronavirus vaccine raise fresh hopes of a way out of this pandemic. And coming up, Formula One's Lewis Hamilton on his hopes of inspiring others to take up racing after his latest victory.
Coming up on Sports Day on BBC News, it's been a strong start for Novak Djokovic at the O2 in London. The world number 1 beat Diego Schwartzman in straight sets at the opening round of the ATP Finals.
Doctors specialising in type 1 diabetes say they're increasingly concerned about the mental health impact that managing the disease has on patients, especially young women. Diabetes UK estimates up to 40% of young women aged 15 to 35 with type 1 will suffer from an associated eating disorder at some point. Now, NHS England has developed 2 pilot schemes to try to understand the problems, as our correspondent Jeremy Cook explains in this report, some of which was filmed before the coronavirus pandemic.
When you're hypo, all you want is sugar. It's like when you're drowning and you only can think about air.
Living with type 1 diabetes. A year in the life of Naomi. A year of fear and uncertainty. Even before the COVID crisis, things were tough.
I get really shaky and hot and my heart beats fast.
Her body can't make the insulin that we all need.
Injection number 7 today.
To control blood sugar. And so there's a lifelong, constant cycle.
Check my
of testing,
blood,
and injecting, and worrying.
Whoa. 2.8.
It's a full-time job that you can't quit. A massive burden that you didn't ask for, didn't expect.
Naomi's consultant, Dr. Helen Partridge, is dedicated to treating diabetes.
Are you doing your insulin yourself?
She knows that most of her patients cope with the demands of type 1, but that it is hard.
You've got to learn to live with it day in, day out. It's not going away, unfortunately. And so actually the psychological aspect is huge.
It means many patients with type 1 at some point experience mental health problems.
I hated it. I hated diabetes.
Eddie is okay now, but as a teenager and type 1 patient, he suffered burnout. That's when the burden of it all becomes overwhelming. He stopped taking his insulin.
I just wanted to be normal. I just wanted to be like my mates. And I just thought, I'm invincible, I can get through this, nothing's going to affect me. I started getting problems with my eyes, and I had problems with my feet, and then I had problems with my stomach.
Naomi is 33 now. She was admitted to an eating disorders unit.
I was in the inpatient ward for about 7 months.
She didn't have anorexia like the other patients here, and while they struggled to eat, Naomi struggled to take her insulin.
I just couldn't handle the physical or mental demands of diabetes anymore.
For the first time, Naomi was treated for both her diabetes and her burnout at the same time. A groundbreaking, joined-up approach.
You hadn't been taking your insulin for a long time.
Diabetes patients treated by psychiatrists.
These people are seriously unwell, and they're putting themselves at harm every day of their lives if they don't take the insulin. They could die.
What has this place done for you?
Saved my life.
Seriously?
Yeah. I really honestly think I would have died if I hadn't come in here. I couldn't do it anymore.
Down to the floor.
The physical risks of type 1 diabetes to eyesight and limbs and mobility are well known.
Move over to your other eye.
But this NHS pilot scheme explores the mental health link too.
We want to look at where we are with physical and mental health, putting it together, trying at different ways to tackle it. It shows our team's belief that if we do tackle these two together, it will help improve outcomes.
For Naomi and others living with type 1, the demands can feel too much, and the COVID crisis has piled on the pressure.
Today's a really hard day. I'm sick and tired of numbers and thinking about diabetes all the time.
The team at the hospital are constantly remotely monitoring Naomi, and they know she's struggling.
They've called me in because, well, I think because I just haven't been taking care of my diabetes and I've been hit with burnout pretty bad.
Researchers found that this specialist, joined-up, detailed help is essential for patients like Naomi.
Whether or not there's a cure, I don't know, but even if there's never a cure, there's still hope. There's always hope, and we get to choose life every day, see it as an opportunity to choose life.
Jeremy Cook, BBC News, Bournemouth.
And for details of organisations in the UK which offer advice and support with diabetes, go online to bbc.co.uk/actionline. With just over 6 weeks to go before the Brexit transition period ends, talks have resumed in Brussels over a future trade deal with the European Union. The main sticking points are over competition rules, state aid for businesses and fishing rights. Our Europe editor Katya Adler is in Brussels for us. A really crucial week. Any signs of a compromise?
Well, there's going to have to be, Sophie, if not this week, the next. And look, I have sympathy. How often have you heard that this is crunch time for these trade talks? But let's do the maths. 6 weeks to the end of the transition period. A deal doesn't just have to be agreed by then, but there also needs to be time for it to be signed off by Parliament in the UK and here in Brussels in the EU Parliament as well. So what's holding both sides back? Well, basically, difficult political compromises. There's a number of those, but broad brushstrokes for the EU. It has to give in big time on the amount of fish that it will catch in UK waters. That's difficult for coastal nations like Spain and France. And as for the UK, well, the government does not want to be tied to Brussels' regulatory apron strings after Brexit. But the EU says, you know what, if you want to have access to our single market that no other non-EU member state has, then we're going to have to agree some common principles when it comes to competition regulations. And we're going to have to agree how to keep to those regulations as well. Now, both sides know these compromises are coming, and both sides still say that they want this deal. But what we don't know, Sophie, is whether both sides are willing to move enough to clinch one.
Katya, thank you. Let's take a look at some of today's other news now. A senior officer at British Transport Police has accepted the force let the public down on the night of the Manchester Arena attack. At the public inquiry, Assistant Chief Constable Sean O'Callaghan agreed mistakes had been made, including having no police officers in the arena foyer, where the bomber Salman Abedi was hiding before the explosion. The Grenfell fire inquiry has been told the main supplier of insulation on the refurbishment, Celotex, deliberately cheated to pass a fire safety test in 2014. Former product manager John Roper said he was involved in adding non-flammable magnesium oxide boards into a testing rig to reduce the speed and height of the fire spread, and then removing reference to the boards from marketing material about the insulation. Celotex's current management says it was unaware of issues with the test and the product passed in 2018. Dentists have carried out roughly 19 million fewer treatments in England since March compared to the same time last year, according to figures seen by the BBC. The British Dental Association says practices are operating at a fraction of their capacity as new regulations mean extra coronavirus measures are needed to minimise the risks to patients. Lewis Hamilton says he hopes young people will be inspired to take up the sport of motor racing after his extraordinary achievement yesterday, equalling Michael Schumacher's record of 7 world titles. The British driver has clocked up 10 wins out of 14 races this season, following Sunday's victory in the Turkish Grand Prix in Istanbul. Here's our sports correspondent, Joe Wilson.
Lewis Hamilton wins the Turkish Grand Prix.
Thank you so much, everyone, for your support.
Lewis Hamilton's victory in treacherous conditions in Turkey was appropriately a masterclass. His 94th race win, his 7th world title, the best numbers ever. But what defines Hamilton now is not simply his driving. His interests and his interviews extend far beyond any formula.
Every kid should have the right to equal opportunity, equal education. It shouldn't be dependent on the colour of your skin. It shouldn't be dependent on your religion or where you live, you know. And I think that's something we want to really we have an opportunity and a platform here to raise awareness for something. And it's not political, it's human.
At the home of British motor racing, the Silverstone Experience traces the sport. From the first racing drivers to Michael Schumacher, no one surpasses Lewis Hamilton. And precious few in any sport share that level of success. We spoke to Britain's most successful runner at this year's London Marathon. Does Mo Farah think Lewis Hamilton is acknowledged enough?
Once he gets knighted, he will be. He's a champion and history doesn't lie. What he's done for sports and to put, Formula One on the map and to go after record after record, it's incredible. And for any youngsters out there who have a dream, it is possible.
Mo Farah is a knight, as is Andy Murray. Jessica Ennis-Hill is a dame, the other outstanding British individuals of this sporting era.
Lewis Hamilton!
Now, Lewis Hamilton resides in Monaco, but his supporters stress he's still one of the top 5,000 income taxpayers in the UK. Well, pressure's growing in Parliament for Hamilton's knighthood.
Lewis Hamilton now, today, is the biggest superstar, British superstar in global sport. And it is astonishing that he hasn't been given this high honour yet, like other sports stars have.
It's clear that Lewis Hamilton has many motivations: human rights, the environment, winning. We will hear more of them all in months and maybe years to come. He told us in Turkey he's just got started. Joe Wilson, BBC News.
And finally, a British diplomat has been described as a hero after diving into a river in central China to save the life of a woman who was drowning. Stephen Ellison, who's Consul General in Chongqing, was walking alongside the river when he spotted the student face down in the water. Our diplomatic correspondent James Landell has the details.
A sunny day by the river, but look closely on the left. Someone's fallen in. There's a moment of shock. No one moves. The woman's clearly struggling as she disappears under the bridge. She's beginning to lose consciousness. But step forward Stephen Ellison, Her Majesty's Consul General in Chongqing, with natty socks. The 61-year-old diplomat didn't hesitate.
There's no time to think, there's no time to consider. There's no
rational decisions. There was a girl clearly in some great difficulties, and I think, you know, if no one had taken action, she clearly would have lost her life.
As he pulls for the bank, he lifts her face clear. For a short time, he feared the worst. But suddenly, she's breathing again.
I'm sure someone would have jumped in. I was just sort of first to get my shoes off and jump in.
After a struggle, they eventually haul her up, and our sodden hero climbs out to the side.
I've had a few comments from my friends on the socks, yes. Unfortunately, I didn't have time to take my iPhone out of my pocket, so that's gone and seen better days, I think, now. So,
Mr. Ellison has been hailed a hero in China, where his courage has been shared with millions on social media and done much to improve Britain's reputation. The woman, a 24-year-old student from Wuhan, has recovered and invited her rescuer to dinner next weekend. James Landale, BBC News.
Great story. Time now for a look at the weather with Darren Bett.
Hello there, Sophie. The next couple of days are going to be very mild for the time of year, but with a lot of cloud. And for western Scotland, there'll be heavy rain and perhaps by the middle of the week, some flooding as well. We've got some patchy rain and drizzle around at the moment. That's pushing its way eastwards, but it's really going to be steadier and heavier rain that sets in across western Scotland through the Highlands, Argyll and Bute. A lot of cloud around tonight. If anything, temperatures are going to be rising 12 to 14 degrees by the end of the night, and by this time we'll have a stronger southwesterly wind. That will blow in more cloud again during tomorrow. Bit of drizzle over some western hills. Most of that rain, though, continuing in western Scotland. And it's going to be very mild. Temperatures widely 15, 16 degrees. Get some sunshine, though, to the east of the high ground. And we could see temperatures up to around 18 Celsius. Now, this very mild air is coming from a long way south. This is tropical maritime air. It's not going to last forever. Look at what happens, and by Thursday the winds are coming down from the north and it will feel much colder. Wednesday, though, is transition day. We've still got some rain around, heavy again in Scotland, turning lighter as it runs eastwards across England and Wales, where in eastern areas we've got the last of this very mild air. But the really cold air is yet to arrive. Now, we could see some wet weather for a while on Wednesday night, but it will turn very windy. And with that northerly wind by Thursday morning in northern Scotland, there could be some snow and icy patches. By this time on Thursday morning, though, the strongest of the winds will be down those North Sea coasts. Those will ease down through the day. There'll be some sunshine. The showers will become fewer, but it's still going to feel cold, particularly in those winds. Maybe 6 or 7 degrees in Scotland, perhaps 8 or 9 in the Midlands. Sophie.
Darren, thank you. And that's all from the BBC News at 6. It's time now for the news where you are. Goodbye.